All right, hi, this is Shelby Norris. This is my week 13, chapter 13 discussion. So we've got 4 different questions for this week, and I wrote down a list of notes for this one because I felt like this was kind of research heavy. So number 1, it says, what is one health practice that media and news frames frequently recently, and how has that influenced your opinions on that health practice? So I said that the media has been covering like vaccinations a lot lately, especially in light of like everything that's going on with the measles outbreak in Texas. Like the reports are indicating that over 480 individuals in Texas have been infected, and like cases are like appearing in neighborhoods and like stuff like that in like New Mexico and like Oklahoma and Kansas. And the situation has brought attention to like a lot of vital importance of vaccination and like why people need to be vaccinated or don't need to be vaccinated. And this extensive research has kind of shown how critically of a role vaccinations play in like disease outbreaks and stuff. And I think it's just like one of those things like the public health or like the public has to decide like for their health on whether they get vaccinations or not. But I feel like it's been covered in media a lot recently. Number 2, does one TV show or one movie cultivate your understanding of healthcare? And was it positive or negative? Honestly, okay, I'm sure I'm not the only one who said this, but Grey's Anatomy is like a medical drama, and I know everybody knows, like, everyone's watched it. And I feel like it's totally shaped the like public perception of healthcare a lot. Because like it's like gives you a bunch of engaging narratives and like different storylines like with like the drama in between. But I feel like there's been studies have shown that like these shows can sometimes present unrealistic portrayals of medical procedures and like patient outcomes and stuff. And like one study found I wrote this down. One study found that viewing fictional medical television programs had negative influence on viewers' health-related knowledge, perception, or behaviors in 11% of the cases. So I feel like this is kind of one of those things with health literacy that goes back to it. Like if you're getting information off of like Grey's Anatomy, like it's probably not all that accurate. So this suggests that like shows can raise awareness about medical issues, but they can be like kind of misleading when it comes to like the like actual reality of healthcare. This was on OUP Academic. It's called like, it says like the Grey's Anatomy Effect Unraveling, something like, well, anyway, okay, I'm moving on. Okay, number 3, what do you notice in direct to, why am I having a stroke? What do you notice in direct to consumer advertisements on medications? What are some patterns? So like in these pharmacy advertisements and like pharmaceutical advertisements, a common pattern is the emphasis of benefits of a medication, and then they also like show like, okay, y'all know what I'm talking about in like those like commercials where it's like I can't think of a medication right now, but like where it's like, if you take this medication, you're gonna be so happy, and it's like some grandpa like swinging his kid like who has like arthritis or something, and it's like, take this medication and you can like play in a park with a grandchild. So I feel like it's always like accompanied by like visuals of like happy and healthy individuals and stuff. And then there's like that really fast bit of like the like side effects, and they're like, you could also die. And they're always like really like quick, and then they're like not in a prominent manner, and I feel like this approach leads to an overemphasis of like the positives while it downplays all of the risks. And I feel like these ads are like encouraging you to like ask your doctor about the medication, which is good. That I'm glad that it's like go to an actual healthcare provider. But I do notice that all the time that it's like, this is gonna make you feel so much better, and then it's like, by the way, you could also really die, but it says it really fast and nobody notices it. But like at least they're like promoting like you going to your doctor and your healthcare provider to talk about it. Those are all the patterns I've seen. So like I think I rambled a little bit, but basically it'll make you happy, you'll feel better, but there are risks, and they say it really fast, and then they're like, go ask your doctor. The number 4, what are some advantages of these commercials and what are some drawbacks? So some advantages are like an increase of public awareness about different diseases and stuff, and it increases the awareness of available treatments too. So it like encourages people to go and like seek medical advice, which they like could be ignoring that problem to begin with. So I feel like that can like destigmatize certain health issues and like make people want to go and talk to their healthcare provider, which is awesome. So that's such an advantage. I think that the drawbacks again is like sometimes misinformation that we talked about last week. And I feel like they overemphasize like the treatments and stuff and how like awesome they are. And like they're underemphasizing that risk, like I talked about in question 3, where it's just like there's so many things that could go wrong, but it's like, don't worry because here's a happy grandpa swinging his child. I also feel like people might be like, okay, I don't know if this is completely bad, but I feel like people might be nervous to like go to their doctor when they get this treated, and then they don't get the prescribed medication that they saw online. And I feel like since we live in such like an online like time, that it's like, oh, like I saw it online, so I'm sure it works. Or I saw it on the TV, it probably works. So like if they were to get something that's either like over the counter, like off, or like a different brand that they don't know about, they might be deterred for like taking the brand that they don't know, just because they're like, well, I saw that one online, you know, like stuff like that. But in conclusion, I just kind of feel like it does play like a role about like, you know, it publicly plays a role about treatment options, and I think it's great. I just think that sometimes it might just pressure patients or physicians to like, you know, prescribe this drugs that are on the TVs instead of the ones that like they actually need, just because like people know about them. But yeah, this is a really cool week. Thoroughly enjoyed this one. Thank you so much. See you next week.